Welcome to the deep dive. Today, we're focusing on something that, well, it might affect how your pet's eyes look and function, specifically the colored part, the iris.
That's right.
We've got an informative piece called Canine and Feline Iris Atrophy as our source today,
Hmm.
and our goal really is to get a solid understanding of this condition,
Right?
what it is, why it happens, and, what it actually means for our dogs and cats.
Precisely. We're going to explore the ins and outs of iris atrophy in pets. The aim is to give you a clear picture of the causes, the signs to watch for, and sort of the bigger implications.
Right.
All without getting too bogged down in complicated jargon. We're really after those key insights, the things that stick with you.
Okay, let's jump right in then. What exactly is iris atrophy?
Well, at its core, iris atrophy is basically a breakdown or degeneration of the tissues that make up the iris.
Okay.
This involves both the main structural part, the stroma, and a layer of cells at the back called the posterior iris epithelium. And this degeneration, it can lead to a loss of function in those tiny muscles that control pupil size.
The ones that make it bigger and smaller?
Exactly. The sphincter muscle, which constricts the pupil, and the dilator muscle, which opens it up. We also see a thinning of blood vessels in the iris and a fading of its color, loss of pigment.
So, in practical terms, what might someone actually notice? What does it look like?
You might see the colored part of the eye, the iris itself, looking thinner than usual. Sometimes this thinning gets so, well, significant that actual holes can develop in the iris.
Holes, wow.
Yeah. And because that muscle that shrinks the pupil is often affected, you might notice the pupil, the black part, doesn't get as small as it should in bright light. It might also look irregular, maybe a bit scalloped around the edge. That's something we call dyschorhea.
Okay, dyschorhea, irregular shape.
Exactly.
Yeah.
So a key takeaway here is that these changes in the iris can sometimes, signal weakening of the eye's internal structures.
Right, so fundamentally a structural weakening. Now, our source mentioned different types of this atrophy.
Yes, there are two main types to think about. The first is called senile or primary iris atrophy. And like the name suggests, this is related to the normal aging process.
I was getting older.
Pretty much. The second type is secondary iris atrophy. This happens because of another underlying eye condition.
Ah, okay.
And the most common trigger for this secondary type is long-term inflammation inside the eye, which vets call uveitis.
Uveitis.
Right. So it's either just time passing or another problem causing the iris to degenerate.
That makes the distinction quite clear. Age versus, well, something else kicking it off. Who tends to be affected by these types?
Well, in dogs, this age-related, the senile type, it's actually a fairly common change as they get older.
Okay.
It can happen in any breed, but we tend to see it more often in smaller breeds. Think miniature and toy poodles, miniature schnauzers, chihuahuas, those types.
Interesting. The little guys.
Yeah. Now, in cats, iris atrophy is generally less common. And when it does show up, it seems to be more frequently seen in cats with blue irises.
Oh, really? Any idea why?
The source doesn't elaborate much on the why for blue irises, just notes the correlation. Now, secondary iris atrophy, that's different. It can affect any breed of dog or cat because it's linked to whatever underlying condition they might have.
So it could be a clue.
Exactly. It highlights that iris atrophy can sometimes point to other, maybe more serious underlying eye issues like that inflammation, uveitis. So detecting it early could be crucial for managing those other conditions.
That's really important for us pet owners to keep in mind. So what are some specific signs, things that might make us think, maybe this is happening? What should we look for at home?
Okay, good question. There are a few things owners often report noticing first. One is a pupil that seems consistently larger than normal, even in bright light. Or maybe a pupil that just has an unusual shape in one eye or maybe both.
Okay, big or weird-shaped pupil.
Right. And your pet might also seem more sensitive to bright light, squinting or looking uncomfortable outside on a sunny day. That's photophobia.
Right, the light sensitivity.
And a really important clue, potentially, is if your pet has a history of eye inflammation. Those uveitis episodes we mentioned.
Got it. And what might a vet pick up on during an exam?
Well, a vet will definitely check the pupillary light reflex, PLR we call it. That's how the pupil normally shrinks when you shine a light in the eye. With iris atrophy, this reflex might be, well, weaker than expected, maybe even absent altogether. But other reflexes, like the blink reflex when you touch near the eye, or the dazzle reflex that squint in really bright light, those would likely still be normal.
Okay, so just the pupil's reaction to light is off.
Often, yes. They might also notice the pupils are different sizes between the two eyes. That's called anisocoria, especially if one eye is more affected than the other.
Anistocoria, different sizes.
Yep. And they might see that irregular scalloped edge of the pupil we talked about. Almost looks like it's been nibbled at.
That moth-eaten appearance you mentioned earlier, that's a very visual way to describe it.
It is, isn't it? And it's quite a telltale sign.
Uh-huh.
Another thing a vet might see, especially with more advanced atrophy, is the tapetal reflex shining through.
The eye shine.
Exactly, that reflective layer at the back. If the iris tissue is really thin, or if there are actual holes, you might see that reflection through the iris itself. It can create these sort of translucent patches, or even look like there are multiple pupils.
Whoa.
Yeah. And sometimes you might even see thin strands of iris tissue still stretching across the pupil area. And of course, if it's secondary atrophy linked to uveitis.
Then you'd see signs of the uveitis too.
Right. Things like redness or cloudiness inside the eye, maybe some pain. So yeah, lots of visual clues for owners and vets.
Definitely sounds like it. So, okay, we see these signs. How does iris atrophy actually impact our pets? Is their vision affected much? How about comfort?
Well, interestingly, our source suggests that the iris atrophy itself generally doesn't significantly affect their overall vision.
Oh, that's good news.
It is. The main issue tends to be potential discomfort in bright light. Because, as we said, the pupil can't shrink down properly to limit the light coming in.
Right, that photophobia again.
Exactly.
Yeah.
So it's really crucial to understand it mostly affects how they handle bright light rather than causing, a major loss of sight.
Okay, that's a really important distinction. Comfort more than vision, essentially. Now let's dig a bit deeper into causes and risk factors. We've got aging, we've got uveitis. Anything else?
Yes, glaucoma is also listed as a potential cause. That's the condition with increased pressure inside the eye.
Ah, okay. Glaucoma too.
Yeah. And it's important to sort of connect these back to the types. Normal aging is the main driver for that primary senile atrophy.
Right.
Whereas chronic inflammation, the uveitis, and glaucoma are key players in secondary iris atrophy.
So what you're really saying is, while age-related changes can happen, if you see this atrophy starting in a younger pet or if it comes with other eye issues.
Exactly. That's a red flag.
It signals you need to dig deeper. Look for those underlying problems like inflammation or pressure issues. That seems like a really crucial point for owners.
Absolutely. Which brings us neatly to a critical aspect. How do vets make sure it is iris atrophy and not something else that might look similar? What's involved in that differential diagnosis?
Yeah, because getting the right diagnosis matters, doesn't it?
Hugely. For deciding on the right course of action, or if any action is needed, the source really emphasizes distinguishing atrophy from congenital iris anomalies, conditions present from birth.
Like what?
Well, there's iris aplasia, which is super rare, complete absence of iris tissue. Then there's iris hypoplasia, where the iris is underdeveloped.
Okay.
The key difference there is timing. Atrophy signs usually develop later in life, whereas hypoplasia would be noticeable much, much earlier.
Makes sense. Age of onset is key. What other congenital things?
There's iris coloboma. That's a full thickness gap in the iris from incomplete development.
Yeah.
Interestingly, this is sometimes linked to the merle coat color in some breeds.
Oh, like in Aussies or Collies?
Potentially, yeah. And there might be lens issues along with it. Again, age of onset is a differentiator from atrophy. Then there's polychoria, super rare, where an animal has more than one actual functional pupil.
Multiple pupils, wow.
Yeah. And persistent pupillary membranes, or PPMs, these are leftover tissue strands from development, but they usually come from the middle part of the iris, not the edge, and they look different from the moth-eaten edge of atrophy.
So it sounds like where the abnormality is and when it showed up are really important clues for the vets. What else might look like iris atrophy?
Pupil dilation from glaucoma is definitely on the list.
Yeah.
But with glaucoma, you'd usually expect other signs, right? High eye pressure, maybe a cloudy cornea, red eye, possibly an enlarged eye, and the pet might actually be losing vision.
Okay, so a different cluster of signs.
Exactly. And also adhesions, where the iris sticks to the lens or the cornea. We call those synechia. Yeah, they can definitely distort the pupil shape, but they usually happen after uveitis or some kind of eye injury. So the pet's history becomes really important there. Vets really rely on a thorough exam and looking carefully at all these specific signs to tell these conditions apart.
Okay. So if we suspect our pet might have iris atrophy, what can we expect during the vet visit? How's the diagnosis usually made?
The physical eye exam is absolutely key. The cornerstone, really. Your vet will look very carefully at the iris, the pupils, check those light responses we talked about,
Right.
and they'll likely perform tonometry That's a simple test, usually quick, to measure the pressure inside the eye.
To check for glaucoma or uveitis signs?
Precisely. Low pressure might point towards uveitis, high pressure towards glaucoma. If it's just straightforward primary senile atrophy, you'd typically expect the pressure to be normal.
Okay.
And the good news is that specific blood tests or, fancy imaging usually aren't needed just to diagnose the iris atrophy itself.
That sounds relatively straightforward, diagnosis-wise. So let's talk treatment. Once it's diagnosed, what can actually be done?
Well, the first thing to understand is that the iris atrophy itself, the damage that's done, it's not reversible.
Ah, okay, so you can't fix the iris tissue.
No, unfortunately not.
Yeah.
However, if it's secondary atrophy caused by something like uveitis, then treating that underlying condition effectively, that might help slow down or even stop the atrophy from getting worse.
That makes sense. Treat the cause.
Exactly. And regardless of the type, if the pet is bothered by bright light, showing that photophobia,
Yeah.
then simple management helps. Making sure they have access to shady spots, especially during peak sun hours, can make them a lot more comfortable.
Just environmental management. Are there any specific medications for the atrophy itself?
For the age-related senile type, no, there isn't a specific medical treatment to reverse it or stop it progressing with age. For secondary atrophy, like we said, treatment is all about the underlying cause. So if it's uveitis, you'd use anti-inflammatory meds, maybe eye drops or pills. But the source makes one really important point about meds. Avoid topical atropine.
Atropine eye drops. Why is that?
Atropine is sometimes used to dilate the pupil, but if the iris muscles are already weak from atrophy, atropine can make the pupil even larger and just worsen the light sensitivity, make the photophobia worse.
Oh, right. Definitely good to know. So, avoid atropine. What can we expect long-term then, once a pet has this diagnosis?
Well, with the senile age-related kind, it's possible the changes might gradually become a bit more obvious as the pet gets even older. It can be progressive, slowly.
Okay.
But with secondary atrophy, usually once that underlying disease, the uveitis or whatever it was, is well managed and controlled, the iris atrophy itself typically doesn't progress much further.
That's good.
And the really reassuring thing, the main message here, is that in the vast majority of cases, the animal's actual vision remains largely unaffected.
That's definitely the key takeaway for peace of mind. So just to quickly recap our deep dive on iris atrophy. It's a breakdown, a degeneration of the iris tissue. Can happen naturally with age, especially in smaller dogs.
Right, the senile type.
Or it can be secondary to other eye problems like inflammation, uveitis, or glaucoma. And while it might change how the eye looks, that irregular pupil shape, maybe holes, and cause some sensitivity to bright light,
Photophobia.
it generally doesn't have a major impact on their actual ability to see. Recognizing those signs, like the pupil changes or light sensitivity, is important so you can get a vet check.
Definitely, for a proper diagnosis and to manage any underlying issues if it's the secondary type.
Absolutely.
And, when you think about it, how even these sort of subtle changes in the eye can reflect bigger things, like aging or underlying health issues. Yeah. It really makes you wonder, doesn't it? What other quiet signs in our pets, or heck, even in ourselves, might be worth paying a bit more attention to.
That's a fascinating thought.
What connections might be there, between the health of one part of the body and another that maybe we're only just starting to really appreciate? Something to ponder.